Hi everyone, my name is Ravi and welcome back to another video where we are going to discuss about one of the consulting case problems already been taken in DBA. So the title of the today's case is the future of primary health. This particular problem was taken up in 2023-2024. This particular problem was taken up in 2023-2024 in the ninth, which was the basically the ninth cohort of the DBA. How I'm gonna proceed is firstly I'm going to go through the case description. I'll try to uh, develop an overall understanding of the problem space which the client is coming from. I'll try to analyze what the client requirements are. I'll uh, try to break it down into fundamental blocks and just try to analyze and develop an overall understanding of their requirements of no what could be the potential solutions be and what could be the consequences with that solution if we propose that to the client. So the idea over here is let me just do a brainstorming over the case and let me try to develop a foundational idea and understanding of the case. So let's go ahead. With non-communicable diseases causing 77% of deaths in UAE, the health industry needs transformative innovations. It is aimed to revolutionize healthcare to keep Dubai 10 years ahead of other global cities. The Dubai, the DBA inquired about current gaps in Dubai's healthcare service, anticipated future advancements, and created a comprehensive plan to bridge these gaps. The goal is to design the future of healthcare, focusing on infrastructure, technology, preventative medicine, staff, and patient interactions. Uh, All right, going through the case description, although it's not very clear that is it coming from the DBA, is it coming from the Dubai government, or is it coming from any nodal agency, or is it any private body? So we are quite kind of unclear with that. However, we are very clear of the problem statement to which the which has been proposed, which has been put forward. It is that and they had given it and they had given figures for that too. So they say the statement says that okay, 77% of deaths in UAE are happening due to non-communicable diseases, and according to the studies, it says that these kind of diseases are preventable if proper precautionary measures are being taken in well in advance. So these kind of diseases are can be treated, uh, and the likelihood of them getting serious can also be substantially be reduced down. So the idea over is uh, what what are the necessary changes the government or the all the stakeholders involved could should do so that the Dubai healthcare could advance and can prevent these kind of this spread of non-communicable diseases. So the idea is here to do to to develop an understanding of what is the current state of the primary healthcare in Dubai. What are the key players involved? What are the medical facilities which is available in Dubai, which people are availing, and what are the necessary gaps which should be fulfilled, and what should be the potential advancements the government or the private bodies should be doing in order to address their future future problems when because the population is increasing, right? The government needs to also keep up with the increasing population. Right now there may be a lot of youth, but that youth is going to someday become old, so we need to be have lots of we need to have good medical facilities for elderly as well. The idea over here is to design a very comprehensive overall design, like how can we address the primary health sector of Dubai, and how can we improve that. So that was my understanding of the case. I'll just try to once more present a very clear picture of what I understood so far. So basically, one thing we are not, firstly, we are not very clear with whether this problem is being taken up by a private body or by a company or by the government. So I'm just assuming this to be taken by the government. Number one. The second point is the problem space is very pertinent, is very relevant and important. So the problem statement, the problem domain here say here is about the primary health. According to the figures given over here, they say that 77% of the deaths in UAE occur due to non-communicable diseases, and according to what I'm able to understand from here is that these kind of deaths can be prevented if right precautionary measures are taken well in advance. If right diagnoses are there in place, then we can prevent a lot of these kind of deaths. So the idea over here is how can we improve the primary health care requirement, primary healthcare services in Dubai, and what should be the necessary advancements that the government should be doing or the private body should be initiating, so that they could fulfill the requirements of at the current times, and at the same time can be also be prepared for the future. So that's the goal and of this consulting case. It's quite different. It's not a business problem. It's not a usual industry problem where we do a lot of financial analysis or we do a lot of cost benefit analysis and that kind of financial jargon. It's kind of very much societal, social impact problem, which and also linked with the health sector. So we're going to address it in that way. Now going forward, I'll in the upcoming slides I'll talk about recrystallize on what's the objective of the client, and I'll also try to phase it down in what should be the goals which the client should be doing in order to achieve the objective which they had set for. So stay tuned. Hi, so already we discussed about the case so far. We tried to develop an overall understanding of the case, tried to understand the problem statement from where the which the client has put forward. Now we are going to discuss about the objective and what could be the goal which the client could know could should pursue in order to fulfill their objective. So let's go ahead and read the objective first. So the objective here is they wanted to revolutionize Dubai's healthcare system to set a global benchmark, addressing non-communicable diseases and keeping the city a decade ahead in medical innovation quality care. So the objective is very crystal clear. The mandate is let's revolutionize Dubai's healthcare system, focusing on primary healthcare most importantly in priority, and also addressing the non-communicable diseases, and while doing so ensuring that whatever they are offering it is of global standard, and keeping the city decade ahead in terms of medical innovation and the quality care. So that's the objective which the client wants to achieve. So here I've put forward the goals which the client could follow in a stepwise manner so that they could achieve the objective. So the first is a short-term goal which I would like to discuss, which is identify gaps in healthcare infrastructure and services to prioritize immediate improvement. So healthcare is something which, if we are making some changes to it, or we are, devising out a strategy for it, it should definitely be planned out, keeping very long-term vision in mind. But it should something which should not we cannot neglect it the current state. We really need to, if there's a hospital, for example, definitely we should be having a vision plan of how we can improve that uh, hospitals infrastructure, hospitals facilities. But we should we should not compromise on what can be improved now, because if we are not we should definitely be planning for the next 5 year 4 year, but we should start beginning of the improvements now only. Because people, what will if we don't do it, then what will happen to the people who are currently the patients, or who are going to come in this year or next 6 months, 4 months, 5 months, right? That so the idea is, let's identify the gaps in the healthcare infrastructure and services. Let's do a very comprehensive analysis and study. Let's give some time. Let's do it in a very comprehensive manner so that we could we could be aware of what are the pitfalls, where we are lacking and what are the areas of improvement. But at the very same time, we should also make a note that we should begin making improvements ASAP. We should not wait for no a long time or the studies to get over or the results to come in, and then basing on that we are beginning the improvement. The improvement steps should begin immediately, like whatever the improve whatever the gaps which we are which are very evident, which it doesn't require study. I think improvement should begin then and now, should begin then and there, right? So definitely for big scale improvements, it's definitely going to take time, and that's definitely going to occur in a phase by manner. But what could be improved immediately should definitely be looked at it. So the short term goal, again, restating, let's do a comprehensive analysis, comprehensive study, and understand the healthcare infrastructure of Dubai. What are the lacks, what are the areas of improvements, etc. But at the same time, let's not postpone the improvement process. Let's begin the improvement of the ground level immediately, so that we could so that we could start getting we could start giving the getting we can start benefiting the patients. So that's number one. As short-term goal. Talking about the mid-term goal, it is to integrate advanced technologies and preventive care to reduce non-communicable disease. Having said that, the emphasis is here more on non-communicable diseases. So, along with the improvements we are making, which whatever the improvements which requires immediate attention, which we are doing, and identifying the gaps. At the same time, the mid-term goal needs to be, let's uh, let's have a dedicated team working in this direction, which is working towards how can we be more innovative in terms of what we are offering currently, or how we can stay ahead of the technological curve. So the idea over here is, let's have a dedicated team or a department which is you know uh, working towards the integration of advanced technologies, uh, because uh, uh, because if we really wanted to push the envelope and solve the problem, we need to uh, technology we need to make technology as an important ally. So that's going to help us. So the idea over here as a midterm goal is like, let's keep a tab on advanced technologies, and let's try if we can build it indigenously, or we can outsource from other countries. So let's keep a tab so we can have a dedicated team towards that. Long term goal, having said that, to establish Dubai as a global leader in futuristic patient-centered healthcare. So the idea over here is, let's improve the health of the people. Let's improve the healthcare infrastructure, so that the people are not in a constant worry that okay, if I get ill, what will happen. They should be, if the healthcare infrastructure is well established, the people doesn't have to worry. So the idea over here is, let's make Dubai global leader. And once we are able to fulfill the internal requirements, right? If we are able to fulfill the requirements of health requirement of the needs of the healthcare facilities of people in Dubai, we can even expand that, and we can even push the medical tourism, and we can even entertain uh, the medical tourists from other countries. And I think that would also be a very good source of revenue income in future, if we could see it in that way. So again, I'll retouch upon the goals again once again. So the short-term goal is should be, let's do a comprehensive study. Let's try to invest a dedicated amount of time, involve consulting partners, and make sure we do a very comprehensive analysis of the healthcare infrastructure, so that we are very clear about what are the areas where we lack, what are the gaps which needs immediate attention, and what are the areas where we can improve. And also the same part of this short-term goal is to, let's not postpone the improvement process. Let's begin the groundwork as soon as possible. Whatever requires, maybe it could be improving the bulb lights, or maybe it could be increasing the number of beds, or maybe it's just could be improving the cleanliness of overall hospitals, right? So the idea is, let's begin the improvement process as soon as possible. That should be the short term goal. The midterm goal is, as we know, in order to really achieve this objective, we need to uh, have technological advancements as an ally. So let's have a dedicated team or partners where which is which is dedicating their time in order to understand what could potential be what could potential improvements be in terms of the medical offering. What are the innovative technologies which we could which we could innovate, which we could include in our offerings in order to achieve our objective of reducing the uncommunicable disease. And last and not the least, long-term vision. So how can we keep a very balanced approach, making sure we are doing regular improvements, and uh, then establish Dubai as a global leader. And yeah, so we discussed about what the client should, what the goals, in what kind of a phase-wise manner the client should proceed. So in order to achieve their objective. So now I'll be discussing about the possible good strategies which the client could follow up in order to get their in order to achieve their short-term goals, and then finally being able to win their vision of the objective. So let's go ahead. So discussing about the strategy, the first one definitely will be of gap analysis, which is to assess current healthcare services, focusing on infrastructure, workforce, and patient satisfaction. So I already covered this, that it should be that doing a proper diligent gap analysis should be part of short term goal. It should be done it should be done it should be done immediately. And When I say about gap analysis, I particularly don't I particularly mean that it should be done in a in a very comprehensive fashion. It should not be like, okay, we are doing the gap analysis of only hospitals, or maybe of only private health education, private healthcare facilities, or of ABC. The idea over here is, let's do a very comprehensive uh, full scale end to end analysis of entire healthcare facility, healthcare infrastructure of Dubai, so that we could have appropriate numbers and figures in front of us, and then basing on those figures we could we could take up the decision of where we need to accelerate or where we need to put more attention, like that. And then while doing so of gap analysis, I believe we should, having already said that it should be comprehensive and nothing should be left out while doing the analysis. But I'll also say we need to emphasize on workforce and patient satisfaction also. These are the two factors which maybe can be missed out. We need to take this we need to take the cognizance of this as well, of patient satisfaction, that how much the patient is satisfied with the current services, and if they are satisfied, then it's good and fine. If not, then requires immediate attention. So so the idea over here is doing a comprehensive gap analysis studies. Second is is about preventive care focus, which is to launch initiatives to promote healthy lifestyle and early detection of non-communicable disease. What we say, what we mean by saying this is that we need to initiate at the very same time as many endeavors, campaigns, workshops as possible, which is promoting healthy lifestyle, so that there's a common realization and awareness among the common public that what's the how important their health is, and how even taking small precautionary measures could help them prevent the non-deadly diseases in their later parts of life. So the idea over here is, let's prevent first. So uh, so the id- so we can uh, create an so the idea I'm just jumbling. So the idea over here is, let's create awareness among the people, so that people are aware, and we can have good preventive mechanism as well. So that was it. Coming to the third part, technological integrations. Implement AI, telemedicine, wearable tech, data analytics to enhance diagnostics, treatment, and patient monitoring. So, technological integration was a part which I put in specifically in as the midterm goal, because technological how which kind of technologies which we can integrate, what are the technologies we should get rid of. It's something which is very which requires a very dedicated research work, and I think it should not be things should not be only included for the sake of it. I think for all the decisions which are going to which are going to lie for technological advancement, every decision should be well thought of. Like, okay, what if we integrate it, then what are the pitfalls? We should be also checking whether this doesn't have any repercussionary measures, or it should not uh, should not do more bad than more harm than good. Because if you look at CT scans, then if you may see that uh, the research shows that if the patient is exposed in a lot of CT scan, then there are likelihood of that they might develop some kind of problem or some kind of complications. So the idea here is definitely let's accelerate on the technological integration part, but with whatever the decisions which we are going to take, let's do it in a very well thought of manner. And that was about technological integration. Then I'll touch base upon infrastructure development, talent investment, and patient experience. So I'll go one by one. And by infrastructure development is something which should be for the process of which should be started immediately. Let's not wait for the studies or numbers to come in and then begin the improvement process. I think whatever the normal whatever the uh, whatever the problem which is just in front of us, which is an obvious problems, let's know which let's tackle them. And like for example, if you take up a hospital, then it may be as simple as improving the cleanliness of that hospital, or maybe putting up lights in appropriate lights in that hospital. So the idea over here is let's begin working on ground infrastructure wise ASAP in an immediate fashion. Let's not wait for the studies to come up. Uh, Once the study comes up, definitely we can, while initiating large scale or deep funded infrastructure, the improvements, definitely for that we need to wait for the studies. But for small scale interventions or improvements, I think we should give a green signal as soon as possible, so that we also we can have a government machinery in place where all the small improvements are given green light signal in a very fastly manner, uh, in an expedited fashion, so that no there is no red tapeism or bureaucracy which is uh, stopping the infrastructure improvement. Then comes talent advancement and patient experience. So talent advancement is something which I'll strongly vouch for, or I'll strongly stand for, because it is because ultimately all our every all the main fulcrum of entire infrastructure or entire healthcare facilities is the health giver, right? Is the healthcare giver, healthcare professional. So it is very important for the country to have good healthcare professionals who are trained, who are regularly upskilled, so that they can be aware, so that they can keep up with all the changes happening. And also necessary uh, uh, policy should be there in place, which is helping healthcare professionals to have which is improving their life as well, because so that more and more people could adopt for this career in healthcare. So the idea over here, let's revisit the the healthcare the overall careers of healthcare professionals, and see where we can improve them. Should we improve their average salaries, or whether we should incentivize them by giving them some kind of tax rebates, or maybe helping giving them uh, uh, some kind of special treatment when it comes to maybe uh, you know uh, yeah, in government allowances like that. So it's the idea over here is let's take care of our health professionals very much. Then comes patient experience. I think it is very important that we remain in touch with patients, monitor how they did, and also take regular feedbacks from them, that did their did the treatment which they undertook, was it a success, how happy they are with the surgery, how happy they are with with the overall experience which they have in the hospital. So the idea is, hey, let's learn with each experience. Let's take the feedback uh, you know uh, unbiasedly. Let's take as much feedback as we can and uh, work on that feedback and improve on the services. So that was it. Yeah, so welcome back. So we discussed about the possible strategies which the client could implement in order to achieve the goals and ultimately achieve the vision. So now I'll propose an implementation roadmap, like what could be the potential, how things should be progressing in what manner. So the year one should be the one where we are dedicating the time and effort to doing the proper gap analysis and initiate the pilot tech driven healthcare initiatives. So the idea over here is like, okay, let's begin this gap analysis, but at the very same time, let's not wait for the studies to get over and implement the solution. But whatever the things which require immediate attention or could be solved with minimal effort, let's start to bring that change. Maybe it could be as simple as improving the cleanliness of hospitals, or improving the lights of hospitals, or maybe just improving the healthcare, the emergency number response time. So it could be maybe very simple things, but the idea over here is, let's begin these pilot initiatives as soon as possible. And while when we are initiating, let's also keep a tag or a track on how these initiatives are faring, how these initiatives are doing, so that we can be receiving proper feedback, and whatever the improvements or things which we are receiving from the experiences of the people, we can work upon those feedback and improve. The year two should be the year of expansion, where we are doing the hard improvements on infrastructure, where we are doing investments and basically expanding the medical healthcare network, so that we could we can provide it at scale and could reach out to as many people as we can in an affordable, sustainable manner. And similarly, that should be the part agenda of year two. Then coming to year three, once we have a network, once we have network ready, once we have reach appropriate scale, then the step thereafter should be how we can chase excellence in what we are doing. Like if we are having hospitals, how we can improve the ranking of all our hospitals at the world scale. How we can bring our each individual hospital uh, you know on par with the best hospitals in the world. So the idea over here is the year three should be the year of excellence, where we are positioning ourselves as global leader, and at the same time, let's uh, once we have built a robust network of healthcare system, let's begin to explore international collaborations and also engage more in knowledge sharing between the hospitals of UAE, Dubai, and across the world, so that we could benefit from the best talent from across the world. And yeah, so year three should be the year of positioning ourselves as global leaders, and somebody as international, and we should become somebody who are seen as international collaborators or as trusted partners in terms of healthcare facilities. So I hope this roadmap ensures Dubai's healthcare remains at the forefront of innovation. We need to also addressing current challenges while building a healthier future for its population. So that was it. I'm happy. I'm very happy that I covered this, and it was a great learning session for me too. Now let's meet at the another case consulting video.